All right, let's talk about something you've probably seen advertised. Anesthesia Free Pet Dental Cleanings. It sounds great, right? Clean teeth, no anesthesia risk. But what if that promise is actually hiding a really big, and I mean big, problem? Today, we're going to pull back the curtain on what's really going on.
You know, if you're a pet parent, you've been here. You want to do the absolute best for your little guy, especially with their health. But man, the choices can be so confusing and honestly a little bit scary.
So maybe you've noticed it. Your pet's breath is not great. Or you see some tartar building up on their teeth. You know you've got to do something, but what's the right something? What's the thing that's going to be safe, but also, actually fix the problem?
And let's just be real for a second, because this is the big one for most of us, right? The thought of putting your dog or cat under general anesthesia, it's terrifying. And that's a totally valid fear. It's exactly that fear that sends so many of us looking for another way. And that search, it almost always leads to what looks like the perfect answer. A dental cleaning where your pet is awake the whole time. No drugs, no scary anesthesia, just clean teeth. At least, that's the promise. I mean, when you look at it side by side like this, it looks like a no-brainer. The pet's awake, it's usually cheaper, and it just feels so much less risky than putting them under. It's sold as this safe, natural alternative, but, and this is a huge but, what this little chart leaves out is pretty much the most important part of the whole story.
Okay, and this right here is the absolute heart of the matter. The real danger when it comes to your pet's mouth isn't the stuff you can easily see. It's the disease that's completely invisible.
Okay, if you take one thing away from this, let it be this. Periodontal disease is not just the yellow gunk on the teeth. It's an actual infection, deep down in the tissues and the bone that hold the tooth in place. And almost all of it happens where you can't see it, below the gum line. So, you get one of those anesthesia-free cleanings done, and hey, the teeth look great. The part you can see, the crown, it might be sparkling white. And that gives you this huge but totally false sense of relief. You think, great, problem solved. But what's really going on just a few millimeters down?
And boom, here's the truth. This is a dental x-ray. On the outside, these teeth might look totally fine, but see those dark shadows around the roots? That's not supposed to be there. That is bone that has been literally eaten away by infection. An anesthesia-free cleaning can't see this, can't touch this, and lets this silent destruction just keep on going.
I love this quote from a board-certified veterinary dental specialist. He said it's like putting a fresh coat of paint on rotten window frames. Think about that. It looks pretty on the outside, but the rot underneath is still there and the whole thing is about to collapse. So, okay, if that's just a cosmetic touch-up, what's the real deal? What does a proper medical dental procedure actually involve? Let's get into it. The proper term you'll hear vets use is a COHAT. That stands for Comprehensive Oral Health Assessment and Treatment. And the name says it all, right? It's not just a cleaning, it's an assessment and a treatment, a full-on medical procedure to find and fix disease. A real COHAT is a whole different ballgame. It's a very careful, step-by-step process. And step one is always safe general anesthesia. That's not just to keep them from feeling pain, it's also crucial for protecting their airway. Once they're safely asleep, the vet can finally do their job. They can do a tooth-by-tooth inspection. They can use a special probe to check for those hidden pockets under the gums where the infection lives. They take full-mouth x-rays to see the roots and the jawbone, stuff you could never see otherwise. And only then, after all that diagnostic work, do they do the deep cleaning, both above and below the gum line, and finish with a polish to smooth everything out. And this right here shows you exactly why anesthesia is a must. There is just no way you can do that delicate probing you see or get these crystal clear x-rays on a pet that's awake. It's just not possible. And those two things, they're the whole key to finding the hidden disease. Look, this isn't just my opinion or your vet's opinion. The science and even the courts have weighed in on this, and the consensus is crystal clear. So let's look at the hard evidence, and then let's tackle that fear of anesthesia once and for all. Okay, get this. A major peer-reviewed study came out in the Journal of the American Veterinary Medical Association. They looked at this exact thing, and their conclusion, anesthesia-free cleanings provide, and I'm quoting here, no demonstrable medical benefit. Zero, nada. And it's not just the scientists. The courts agree too. In a really big ruling, a superior court basically said, nope, this is a cosmetic procedure, period. They even made it illegal for providers to claim it has any health benefits at all. That's huge. Okay, but what about that risk, that fear we all have? How risky is anesthesia really? Well, a huge study looked at this. For a healthy dog, the risk of a fatal complication from anesthesia is just 0.05%. Let me put that another way. That's a 99.95% survival rate. With modern monitoring, it has become incredibly safe. So this totally flips the script on what's risky, doesn't it? The truly dangerous choice is the one that seems safer. Anesthesia-free cleanings give you a false sense of security, which means you delay the actual medical care your pet needs. Plus, they can actually damage the teeth and gums, and there's a real risk of your pet breathing in bacteria. And it completely misses all the other painful stuff a vet would find, like broken teeth or even tumors.
So where does that leave us? As someone who obviously cares a lot about your pet, what do you do now? Let's talk about a real plan for their long-term oral health.
So the big takeaway here is pretty simple. It's not about having super white, shiny teeth. It's not about cosmetics. The goal is to have a healthy, pain-free mouth. And that means we have to focus on preventing that invisible disease we've been talking about. A professional CO hat is for finding and treating problems, but you're on the front lines of prevention at home. The absolute gold standard, daily brushing. I know. It can be tough, but it's the best. If that's just not going to happen, there are silver options like oral rinses, and even bronze options like special dental chews and foods. Just make sure they have the VOHC seal of approval. Doing any of these is way better than doing nothing. So, let's leave it here. The conversation totally changes once you know this stuff, right? It's not about anesthesia versus no anesthesia. It's about medical procedure versus cosmetic touch-up. So the real question to think about is this. Now that you know the biggest threat is invisible, what questions are you going to ask your vet to build a real, comprehensive health plan for your pet?